Hi, I'm Jen Finley, and I'm the Assisted Living Manager here at the Manor at Glacier Hills. I am here to discuss how we facilitate a visit for one of our residents. So the first thing to always keep in mind is that everyone that comes into one of our communities has to be wearing a mask at all times. Of course, all of us colleagues, volunteers, visit facilitators such as yourselves, and family members, visitors, and vendors. So when they come in through the main entrance there at the Manor, if they're not wearing a mask, please offer one to them. There will be a box at the table with all of the equipment on it that has masks in it, and you can ask them to please put the mask on before they enter the Manor. Secondary to that, there will be a stack of papers, and these are our Manor visitation forms. Everybody needs to fill one of these out. The first half of it is all for the family member or the visitor, whoever it is, to fill out themselves. There will be a cup with clean pens. They're to take a clean pen, fill out the top half, and then put that pen in the dirty cup. All of these statements have to be filled out completely, checking yes or no. These yes or no statements are related to symptoms or exposure to COVID, so we want to make sure that both of these are no. If either of those are yes, we would end the visit immediately and they would not be able to come in. Additionally, these three statements will be read and they will sign and date. And once that's complete, we will move on to step number 2. So step number 2 is going to be putting your gloves on. We'll have a box of gloves, typically nitrile gloves. They're going to be purple like this. There may be some clear gloves which are vinyl, but we don't use any latex gloves. Putting gloves on, this is not a sterile type of procedure, so you don't have to worry about keeping them, uber clean or anything. You just need to take the gloves out, just put them on. Make sure that they're not rolled up at the wrist and that they're comfortable. Get all your fingers in the right places. And that's it. So once you've got your gloves on, you're going to take the temperature of the visitor. I've got a demonstrator coming over for me. So you want to make sure you've got your thermometer turned on. Usually that will require one push of the button and a beep will happen. Once that happens, you hold it about 2 inches or so from the person. Hold the button down and release it. You'll get a longer beep and then you'll get a reading. Once you have that reading, you're going to take your own pen. You're going to write down the temperature next to the area that says temperature on the visitation form, and the temperature must be less than 100. If it is 100 or greater, again, the potential visit would be ended immediately. They would have to leave and return at a different time. To turn the thermometer off, you just press and hold it one more time and release, and it turns off. The next step will be doing the swab test. The swab test is very simple. There's only a couple of steps involved, and we're going to walk through it at this time. Currently, we like to have a face shield being worn over the mask. This is the type of face shield that I happen to have. We will have a face shield available and ready for you to use on the cart where all of the equipment's located. This goes on just like a pair of glasses, and it works terrific. So the person that you're going to be swabbing will be standing next to you. You'll have your gloves on, you'll have your face shield and your mask on, and there will be a box with these 3 things on the inside. These are the swabs. This is the test kit, and the dropper is the reagent. The first thing we're going to do is open the package and take out the testing card. If you open up the testing card, it actually has the 3 steps that are involved with making the card work, or for inserting the swab into the card and the drops and so forth. But we're going to walk through this and make it real simple for you. So the first thing I like to do is take my Sharpie marker and put the initials of the visitor on the outside of the card. You may have 2 people coming in for a visit during a certain time, so you want to make sure that you're identifying that person. So let's say we're going to have Tom Jones visiting his mom, and so I'm going to put TJ here for the initials, and then I'm going to put the time down that we're doing the swab. So for sake of argument, we're going to put 11 A for 11 a.m. So next step is to take the cap off your reagent, set it next to you, and then we're going to open up the swab, and this is the end of the swab, and just take it out. It's nothing more than a fancy Q-tip that's a little bit skinnier than a regular Q-tip. What you're then going to do is hand the swab to the visitor and instruct them on how to do the swabbing. So this swab is very simple, and I'm going to, for purpose of demonstrating, I'm going to take off my shield and I'm going to take off my mask. So instruct them to take the swab and go into each nostril just about the length of the swab and maybe a tiny bit more, and just spin it for about 5 seconds, and then on the other side. So just for purpose of looking, you just put it in, swab it around a little bit like this, take it out, other side. It's not painful, it's maybe a little ticklish, but it's a very easy process. I'm going to put my mask back on here. And this. So once they've done this, you're going to take the swab back, take your dropper. On the card, there are 2 holes. The top hole is where the reagent goes. 6 drops. 1, 2, 3, 4, 5, 6. Take the swab, insert it into the hole beneath where you just put the drops, and push it up underneath and spin it 3 times. Remove this piece of tape, maybe, and close it. Then you just set it down and you wait 15 minutes. What we like to do after we've gotten this started is we tell the family that they're free to go outside, they can go sit in their car for their 15-minute period of time. At the end of that 15 minutes, they'll present back to that entrance of the manor, and as long as their test shows negative, then they'll be given a sticker, which you will have, that will have visitor stamped on it and the date, and then they're free to go into the manor building and directly to their loved one's apartment. The visits are 1 hour in length. It's important that we make sure that we remind the families that that the visits only are 1 hour, because there are other people coming in, and based on the state of Michigan's guidelines, we have to stay within a certain amount of people per day and per week. So it's important that they adhere to that. We don't want them to walk around in the building either, so again, they need to go directly to their residence apartment and directly back to the front of the manor and exit when their visit is over. At the end of the 15 minutes, you're going to read this, and there's 2 possibilities. We can have a negative result, or we can have a positive result. There is an example of each one of those on the card, and a negative result up here where it says control will be 1 pink line. That is what you expect to see. If there is a secondary pink line below the first pink line, therefore being 2, that would indicate that that is a positive result. If that were to happen, you would instruct that visitor to leave. They wouldn't be allowed to come in and visit, and advise them, to call their physician or to seek somebody out, from the healthcare profession and let them know that they had a positive, rapid test. And that's it. This is going to show you exactly what this card looks like, so that when you're doing the test, you'll just have a little bit better visual. So this is what the COVID card looks like. The control is the line above. The sample line will be below it. When you open it up, it does have the directions that we've kind of all gone through. The first thing you do is you add 6 drops of the reagent to the top, as it shows you, hole. 1, 2, 3, 4, 5, 6. Once you've done that, you recap your reagent and set it aside. Then you take the swab that has been swabbed each side of the nose, and you put it into the lower hole, push it in all the way, and then swirl it 1, 2, 3 times as it indicates on the card. Then you pull the tape off, and it's good to go. At this juncture, you can put the initials of the individual and the time on your card. As you can see, what's happening here is the reagent is starting to soak into the test, and it's slowly wicking up, and eventually this blue line will become pink. This is a negative result, and that's what you should see at the end of that 15-minute period of time. If by chance you end up with a positive result, you will see 2 pink lines, one beneath the other. Once you're done and your 15-minute time frame is up, and you've determined that this is a negative test, you're just going to take it and you're going to throw it into the trash receptacle that is right next to the cart that holds all the equipment. There's no reason to have any special disposal for this. It just goes directly into the trash. Once your testing is complete and you've determined that you've got a negative test result, and the visitor has come back in, you've given them their instructions and their sticker and so forth, you'll then dispose of all the testing materials that you used. So all of the packaging that was required and the test itself, which is self-contained, there's no nasal swab that's exposed, just goes into the regular trash. Additionally, you've got a pair of gloves on that you're going to take off. And taking the gloves off is nothing fancy or special. You're just going to take them off by grabbing a hold of the outside of the glove at the wrist area and pulling it off inside out, leaving it on that one, and then going underneath the other area right at the wrist and pulling it off over that. So you're only touching the inside of the glove that was touching your skin, and none of the outside of the glove is exposed. At that point, you pitch that as well. So you can then utilize hand sanitizer on your hands, which is terrific to get you through until you can go and wash your hands. So hand sanitizer is not a replacement for hand washing, but it's a place to get you and bridge the gap from one step to the next. So I always recommend washing your hands after you've done one of these swabs or anything that involves, touching other people and so forth. But like I said, in the interim, a little pump of hand sanitizer will get you over to wherever it is that you can wash your hands. The last thing will be removing your shield. So face shields, you're not going to be working in an environment where they're terribly contaminated or even contaminated at all. This is merely a protection, in case somebody sneezes when they're swabbing themselves or something like that. So typically all you're going to need to do is take your face shield off, set it aside so that it's not on a table. I just like to set mine up like this so that it's ready for my next time. If by some chance you do have an experience where maybe somebody has coughed or sneezed, even though they've got a mask on, you should be very, very well protected. But at that point, you'll be able to wipe off the exterior of your face shield with an alcohol swab, which will be provided in the cart that you have. So they're packages about this big, 2 by 2. You can just tear it open and wipe off your shield, and it'll air dry very quickly. And then again, just set it to the side. If by chance you have somebody that does come up with a positive test, you're going to indicate to them that they're unable to visit and they'll have to leave. Give them, the advice that, you should seek out either, medical care, or let your, primary care physician know, or something, that you've come for a visit somewhere. They did a rapid test on you and it showed up positive. We're really not able to give any advice beyond that, but at least they know, and then they can take that information and, seek out whoever they see fit. The other thing I'd like to do is reassure you that if by chance this happens, this wouldn't even be considered a direct exposure. A significant direct exposure to somebody that is positive for COVID would be spending at least 15 minutes of time with that individual without PPE and in very close proximity. So in this situation, you'll be well protected with your face mask, your face shield, and your gloves. And of course, that individual is going to be wearing a mask as well, except for the short period of time that they remove it to do their swabbing. So I just wanted to reassure folks that if you do get a positive test, this is not considered a direct exposure, and you'll be safe. Additionally, there is no other disposal method to utilize if that test comes out positive. Again, it would still go into the trash. It's self-contained. And honestly, the way that this virus is spread is it's an airborne entity. So we will be safe with these tests. That's all I have for you. Thank you so much for volunteering. We really appreciate it.